Well, hello, friends. Mark Holmes here, and as always, I want to thank you all for watching, commenting, subscribing, and being part of the Joe Blue Sports Report. Without you guys, as well as you ladies, that this literally does not work. You know, I relate everything in life to football because literally, football really does relate to life. You know, when they used to say football is family, if you ever watch or have heard about 6 degrees of separation, that everything is in six moves of being related to each other. So it's real easy to relate things that have happened on the football field with things that are happening in my life and stuff. And one that definitely relates to football is dealing with my knees. A lot of you have, sent thoughts and prayers and different treatments and things and ideas, and I appreciate all of those. And I'm actually looking for a little help to kind of understand this. Yesterday, I had an MRI. I have an appointment on Tuesday with my orthopedist, and I'm looking at the results from the MRI, or at least reading the results. And if any of you are an orthopedist or a doctor or understand this stuff better than me, maybe you could help ease my mind that this isn't as bad as it sounds, because it sounds really bad to me. Um, it sounds really bad. Okay, so I was in a Tesla yesterday. I did a technique, a 1.5 Tesla MRI performed using image acquisition. And forgive me if I don't pronounce the words right for this because it really is an alphabetical soup. Findings: ligaments and tendons, ACL and PCL. There is a mild degeneration of the ACL. PCL is intact. So mild degeneration of the ACL. Okay. Hmm. Mild doesn't sound bad. Okay. Uh, the medial collateral ligament is intact. So good. So not major ligament damage, right? So the PCL and the MCL are both intact. There's mild degeneration of the ACL, which is probably the reason why it kind of clicks and there's a lot of instability in it. Okay. Lateral. The fibular collateral ligament and bicep tumors are intact, and the idiabanal brand is normal. Okay, all right. So far, it doesn't sound very bad. Anterior, there is moderate tendinopathy of the quadricep tendon. tendinopathy of the quadricep. There's a mild tendinopathy of the pectoral posterior tendon. That's where I'm kind of like, okay, but moderate and mild. Okay, I'm okay there. Meniscus. Okay, now this is where the sections start to get really long and really complicated. There is a moderate to severe denigration of the posterior root of the medial meniscus. There is a complex tear of the posterior horn of the medial meniscus beginning ascendant to the degenerated root, extending along a 2.5 centimeter length of meniscus. There's a fray in the interior margin of the body of the medial meniscus. There's a mild degeneration of the lateral meniscus. That don't sound good. There is a moderate to severe degeneration of the posterior root of the medial meniscus. There is a complex tear of the posterior horn of the medial meniscus, beginning adjacent to the degenerated root, extending along a 2.5 centimeter length of meniscus. There is fraying in the inner margin of the body of the medial meniscus. There is a mild degeneration of lateral meniscus. That's about 2.5 centimeters. Okay. All right. Shall I go on? Osteoarticular structures. There is a thickness collateral or cortical damage on both sides of the joint in the lateral third of the patellofemoral compartment with subconjugal signal changes. There's a 3 to 4 chromatica of the central and medical. I don't even know, but I looked up chromatia. Wait, let's see. Chromatia. Let's see. I thought I looked it up. Okay, so a grade 3 chrondomatica. Grade 3 shows the thinning of cartilage along the active deterioration of the tissue. Grade 4 is the most severe and it indicates full degeneration of the cartilaginous surface, exposing bone on bone rubbing. So let's go back to that real quick here. Wow. There is a grade 3 to 4 chromatia of the central and medial, trochlea. So, yeah. There's a grade 2 chromatica of the central and medial patella. Patella is the thing that holds the kneecap in place. Okay. Let's go on. There is a 10 by 15 millimeter area of full thickness cortical damage on the weight-bearing portion of the medial femur. There is a mild cystic change within the posterior tibia. There is a 1.4 centimeter area of grade 3 chromatica on the posterior tibia. There is a 1.4 centimeter area of grade 3 chromatia, forgive me on this, of the corresponding lateral femur. There's a mild osteoarthritis in the proximity of the tibular-fibular joint, and there's a mild I'm not even going to try that one. Okay, there's more. There's a small joint infusion with mild stenosis, and so I looked up. This is another one of those words. Let's see. Stenosis is when the synovitis inflammation is when the stimulus of the joint becomes inflamed, swollen, which is sometimes called the I can tell you it's inflamed. I can tell you it's swollen. Okay. There's increased fluid within the PCL recess. There are moderate inflammatory changes within the aspect of the intercosternal notch. But there's good news. There is no evidence of Baker's cyst. Why not? Yeah, they got everything else, it seems, in here. Conclusion. There is moderate to severe degeneration of the posterior root of the medial meniscus. There is a complex tear of the posterior horn of the medial meniscus beginning adjacent to the degenerated root, extending along a 2.5 centimeter length of the meniscus. There's a 10 by 15 millimeter area of thickness cortical damage on the weight-bearing portion of the medial femur. There's a 1.4 centimeter area of grade 3 chromatica of the postlateral tibia. There's a 1.4 centimeter area grade of the chromatica of the corresponding lateral femur. There is moderate to severe corrosion of the patellofemoral compartment. So, if anybody out there understands this, if you're an orthopedist or nurse practitioner from that, help a brother out, because I'm trying to figure out, between now and Tuesday of getting my mindset that this needs to have surgery on it, or it's just something that, rubs some dirt on it. But here's where it gets funny. This is where it actually gets crazy. Because this is my right knee that I had a flesh-eating bacteria in. This is from the x-rays. They took x-rays last week of both legs. Medial and lateral space narrowing with patellofemoral joint space narrowing. See, if you look at the joints, you actually want to see space between the bones. Okay? And when that space goes, that's because of all the meniscus and things. And it's bad. That's where, it gets to be bone on bone. Ideally, you want to see a space. So when I've gotten the injections, basically it's putting in like a lubrication in between the joints. So it says mild, this is the x-ray on the two knees. Mild osteophyte formation present in the lateral tibia plateau. Arthritic changes worse on left knee than right. Okay. So what they're saying on the x-ray is, yeah, the right knee here's those problems, but the left one is actually worse. I'm 55 years old. I never played pro football. And at 55, I've got two knees that are shit. I think about Charles Haley, who I went to school with, played football with at JMU, who's only a year and a half older than I am, who had both of his knees replaced about 2 years ago. We love football. Oh my God, I love football. I wish I could still play, knowing that my body is completely fucked up from football. But we have to realize that as much as we enjoy watching football, and again, I never played in the NFL. I never got there. I never been like some of these guys like Brad Johnson that literally can't get out of bed and are younger than me. But guys that play 10 years, guys that are taking all kinds of medication to deal with the pain and things like that. We love the sport. But we have to appreciate what these guys are doing for our entertainment. We look at it and like, oh man, stop being a little biatch. But you're talking about a lifelong dealing with pain. And you got one body. And I hate to see some of these guys that are my age that literally can't play with their kids. So, in the meantime, between now and Tuesday, reading all of this and seeing all this stuff on here, I'm trying to get my mind right on if I've got to have a sixth knee surgery. And maybe some of you can help me out in figuring out how bad that sounds and what are options there. The other knee is so bad that there's like, the only thing we can do is a knee joint replacement. But if you do a knee joint replacement, it's going to be about a year-long recovery. And that year-long recovery does not include doing things that I do on a regular basis, which is construction work, getting down on my knees and working. Laying tile or putting down hardwood floors and things. And literally getting that knee operation ends a lot of things that I do. So, I'm not complaining because I'm lucky that I still have two legs that they may be fucked up, but that they at least still get me around. Be it not like they used to, but they still get me around. So I hope you guys are having a great day. And I'll catch you on the flip side.